Hi, I'm Princess Antailan. In this video, you will learn how to properly sanitize medical instruments in preparation for disinfection and sterilization. Before we start, we need to put on an impermeable gown, goggles, mask, or what we call the PPE or personal protective equipment. This PPE will protect us against splashing or possible infectious materials coming from the medical instruments that we will be sanitizing. Make sure that you will tie it properly so it will not be loose while you are moving. To protect us against possible infectious matter and being injured by medical instruments that are sharps, we need to put on a pair of gloves. Clean gloves will do, followed by a pair of utility gloves. Let us assume that these are medical instruments for a minor procedure. We need to separate instruments that are sharps from others to avoid injury. Discard the sterile drape into a biohazard container. To help remove debris and prevent coagulation of body fluid, we have to rinse the instruments under cold running water. Never allow blood and other substances that can coagulate to dry into the instruments because microorganisms can hide under contaminants and may not be destroyed under disinfection process. Make sure to remove all the debris using a disposable brush on the instrument. After removing the debris, make sure to rinse well all the instruments under hot water. After cleaning, put all the medical instruments on a clean drape and then pat dry using a paper towel. Dry instrument thoroughly, as wet instruments can rust and become dull. Dispose contaminated towel and disposable brush in a biohazard container. To remove possible contaminants, we have to remove your utility gloves, followed by the clean gloves, and perform a septic hand wash. To prevent exposure to contaminants, towel dry your hands and dispose all contaminated towels on a biohazard container. Put on a new pair of clean gloves and decontaminate the used utility gloves and work surfaces to avoid transmission of infectious organisms. Remove your gloves and dispose it into a biohazard container and sanitize your hands. Place the sanitized instrument into a designated area for disinfection or sterilization to prevent possible cross-contamination. And then remove your PPE or personal protective equipment and properly dispose it into a biohazard container. In this video, I will show you how to prepare instruments ready for sterilization. Before we start, we need to make sure that we had all the necessary supplies. First, we need the surgical tools, the gauze, a sterile indicator strip, an autoclave tape, and a sterilization wrappers. Some also use a sterilization pouches. Let's assume that I am preparing for a circumcision set. Ensure all instruments are thoroughly cleaned and dried, as moisture can interfere with sterilization and cause damage. For hinge instruments like this, keep them open during sterilization by placing an item between the handles. Inspect each instrument for damage and wear and confirm all parts function correctly. Once dry and inspected, place the instruments in sterilization pouches or wrap them in sterilization wraps. Include an indicator strip with each package to verify exposure to the sterilization process. Fold the edges using the envelope method to avoid contamination when opening the set. Seal the pouches or wraps securely using the autoclave tape. Make sure to label the set according to what instrument that is inside. For this, I will put circumcision set and then put the date and your initial.